Hi everybody, I'm Dr. Sham, a rheumatologist practicing in Chennai. So now in this video we shall be seeing about psoriatic arthritis. So psoriatic arthritis is again comes under spondyloarthritis. So what all things can happen? See, patient can have psoriasis, it is a skin problem. Again, it is an autoimmune skin problem. It is not the same what we mean in Tamil. Psoriasis is an English term. So many people sometimes they get offended when we tell they have psoriasis. So somebody has psoriasis, there is a chance they can develop arthritis. For example, 10 people have psoriasis, 2 or 3 might develop an arthritis. There are some people who develop both the skin, like psoriasis and arthritis at the same time. There are some people where the arthritis comes first, psoriasis can come later. Many times in our practice, when we look for arthritis like psoriatic arthritis, many patients can have hidden areas of psoriasis, means the patient themselves don't realize that that is psoriasis. You might have it behind the ear, or you might have in the scalp. People might think it's a dandruff, or you might be having in the navel cleft like that. So whenever doctor asks whether you have any skin lesions when you have arthritis, do disclose if you have any suspicious lesions like psoriasis. Or always, in general, these days it is about multidisciplinary management. So whenever I have a suspicion whether that scalp dandruff, whether it's a dandruff or a psoriasis, I ask my dermatology colleague to help with me. So he or she usually tells that yeah, it's a psoriasis, or they told no, it's not a psoriasis. Then we will be able to find out whether the patient is having a psoriatic arthritis or not. So here in psoriasis, it's you have so many things. So one is the skin. Okay. So other than skin, we know joint can be involved. Even in the joint, like spondyloarthritis, you can have the spine involvement, and you can, like rheumatoid, you can also have hand and foot joint. So you can have both axial, we call like the spine involvement, or the hand and foot joint involvement. Some people can have nail involvement. Sometimes the whole finger, like not just one joint, the whole finger, like something like a sausage, gets swollen. That we call a medical term use, it's something called dactylitis. Some people have like no back pain, no arthritis, but they have severe heel pain. There are people who struggle only with heel pain, that we call enthesitis. These are medical terms, but remember, this finger can be swollen like a sausage, or they can have something like an heel pain. So these are all the various aspects. So whenever we discuss with the doctor, or the doctor decides on what drug to be used, so we have to have a drug which has to manage all these things. Sometimes it may not be possible, so you have to use a combination of drugs. Again, it depends on the risk profiling. So we will discuss with the patient whether they are obese. Many times psoriatic patients have fatty liver, the liver functions might be abnormal. Then we have difficulty in choosing the right drug, or other risk factors. So all these things have to be taken into consideration. So remember, there are various domains in psoriatic arthritis. It's not just the skin or nail. It's about arthritis, spine, peripheral, the heel pain like enthesitis, dactylitis. So all these have to be addressed. Thank you.